While ahead of the president's speech, a key Senate Democrat is making one last bid to create a health care compromise. Bloomberg's Peter Cook has the details from D.C. Peter.
Deirdre, Senate Finance Committee Chairman Max Baucus' plan represents the last best hope for a bipartisan health care bill. But as lawmakers return from their August recess today, there's still no guarantee any Republicans will support it or that Baucus' fellow Democrats will agree to his concessions. According to a person familiar with the plan, it would not include a public insurance option to compete against private insurers, but would instead create nonprofit cooperatives to extend coverage to the uninsured. It would cost less than $900 billion over 10 years, making it cheaper than other plans on the Hill. Baucus would pay for the bill in part by a new tax on insurers offering the most expensive health care plans and by a new fee on insurers. They're already pushing back against that. Baucus hopes the proposal will win the support of some moderate Republicans in the Senate opposed to a public option, but in the process he may lose liberal Democrats like California Congresswoman Maxine Waters.
Nancy Pelosi has said that nothing's going to pass that floor without a public option. With all due respect to Senator Dole, the Republicans are not going to support a credible health care reform bill led by the president or the Democrats. We're not going to get their support.
Now, Waters' comments over the weekend highlight the challenge for the president on Wednesday night. Does he scale back his health care goals to win a handful of Republican votes, or does he double down by advocating a bill only Democrats can support and risk getting no bill at all? Baucus still believes his path holds the most promise. Eric, he and the so-called Gang of Six group of bipartisan senators meet today on the Hill as they return to Washington to discuss his plan and its future. A lot of folks will be watching those talks.
Thanks, Peter.